Getting ready for fall should also include a trip to the vet.
Okay, so we have Dr. Lori Tettler, who is a veterinarian at Meyerland Animal Clinic, also a professor at Texas A&M School of Veterinary Medicine, so she knows what she's talking about here. All right, so thank you for coming over this morning. Give us an idea of how often our cats and dogs need to go to the vet, because we were just saying we'd do it every day if we had our choice.
Well, we'd love to have you every day. So it depends on what's going on. Young kittens and puppies should come in once a month until they are about 5 months old, just like a baby goes pretty frequently. Then healthy young adult animals, really once a year is fine unless there's something going on. And then older animals, animals with chronic diseases like diabetes or arthritis, we like to see at least twice a year and sometimes more.
Okay. All right, tell us what you're looking for when we bring in our lovely animals.
Yes. We are doing a full, thorough physical exam, so really nose to tail, and we look at their teeth, their eyes, their ears, listen to their heart, listen to their lungs, make sure everything sounds normal there. Palpating the abdomen, we can feel kidneys and bladder and liver and spleen, all those great organs. And then we're checking the musculoskeletal system, the nervous system, and we're checking the skin, lumps, bumps, infections, all of those things that can tell us a whole lot about our pets because they can't talk to us.
And then are there any specific concerns with the fall coming up? You said maybe once a year. Should we be bringing them specifically in the fall, or it doesn't matter what time of year?
It really doesn't matter unless, as long as they're seeing them about once a year, but there are things to be thinking about in the fall, particularly as hopefully the weather will eventually start cooling off and we'll start getting some rain. There are some diseases that we see more typically in the fall, like leptospirosis, which there is a vaccine to prevent, but it can cause kidney and liver failure, and so we'd prefer to vaccinate for it, but it seems to be more common in the fall. So definitely make sure your dog is up to date on that. Again, when the weather starts cooling off, getting back into the 80s, we're going to see fleas and ticks and mosquitoes again, really coming back with a vengeance. And so protecting against diseases carried by those insect pests, ultimate of importance.
And there are so many meds that can help and make a big difference with that. You know what, a lot of times when I travel, I'll get the update from the border and they'll warn me that canine flu is really prevalent at that particular time. And I always wonder if I should really get my dog vaccinated for that. What do you suggest?
So this is where going to your veterinarian will really help you evaluate what should be specific to your pet's health. And if your dog goes to doggy daycare, goes to dog parks, boarding, grooming, all of those things, really where it's going to be exposed to other dogs, it should be vaccinated against canine influenza. If it's a couch potato at home, less likely to catch it, and that's not something that should be high on your list.
Okay, so we're bringing them in, we're loving up on them. Do you have any #1 tip you want to make sure that we walk away with today?
Definitely find out about their diet, their nutrition, and their teeth. The two biggest problems that we diagnose in dogs and cats is obesity and dental disease. And both of those are so preventable. Not only can we prevent those and treat those, but they also play such a role in other problems. And so if we can alleviate that, we can also prevent lots of other issues.
I think I'd lose a finger on my loving dog if I got anywhere near his mouth, so I guess very carefully, right?
Yes, very carefully.
You're gonna brush those teeth.
Yes,
all right.
but we can teach you how to do that.
Okay, I need a lesson. Thank you so much for coming in.
Thanks for having me.
How important our pets are to us.
Yes.
All right.